You get this shocking news that you have what looks like a primary brain tumor. Then you literally have surgery scheduled, and you have very little time to research, like for specialists and for centers of excellence.
Welcome to Stories of Hope. I'm Christine Hotchkiss. Each week I bring you stories that inspire, educate, and give you hope.
I want to thank my sponsor and podcast producer, the Motivated Mind Group. Everyone knows the topic about cancer. So many different entities, different facets of cancer. And I am very privileged to have you in studio today. So welcome, Dellann Elliott Mydland, to Stories of Hope.
Thank you so much for letting me come on today. I'm so excited to talk to everybody.
Well, you're the president and the chair for End Brain Cancer Initiative, which is actually based out of Washington, and you're sitting right here in Arizona.
I am in warm Arizona.
Mm-hmm. It is, and I hope that we've welcomed you as well.
You have. Thank you so much.
Yes, we had a guest that was with us. Her name is Jen Ortiz. She just had me in stitches, all of us here, and she actually was a 2-time survivor of brain cancer. And then we also know what she's recently gone through. And it was just so impactful. We're like, we need to know more. And she referred me to you. So again, thank you for sitting with us, that we will learn more about your organization and what you provide. So with that being said, please provide us the mission in what your organization does.
Absolutely. And thanks again so much, Christine, for having me. And I know Jen as well, and she is incredibly inspiring. And it's people like her that allows us the privilege to serve the brain tumor and brain cancer patient community every day. So the End Brain Cancer Initiative actually used to be the Chris Elliott Fund. We've been around for 22 years, and my late husband, Chris Elliott, and I founded the organization. And the reason we founded the organization is because we wanted to increase patient access to specialists, to advanced treatments, advanced diagnostics, clinical trials, anything that made scientific sense for that particular patient and their particular brain tumor or brain cancer.
We all hear about cancer, but you just said particular. Be more specific on the particular part.
You bet. What I mean when I say particular, brain tumor and brain cancer. So today we're talking about glioblastoma, GBM, which is the most terminal type of brain cancer that adults are being diagnosed with today. But particular, I mean that everybody's brain tumor tissue is different.
I was not aware of that.
Yes.
Okay.
And so when we realize that and we start thinking that way, then we go, well, why is it that we have standard of care for this particular disease when we know that it's very different in every single person who is diagnosed with it? So that's really important for anybody to know that. Any future person going to be diagnosed, they need to know that their particular brain tumor, brain cancer tissue actually has clues in it in how to treat it.
So that's the question I have, was what are the contributing factors that actually make it specific? You said more adults are being diagnosed with this. Is it our diet, our society? What is it?
Boy, I wish I knew the answer to that, because I really don't. Wouldn't that be beautiful?
Yeah.
If we knew that?
There'd be a cure right away.
There'd be a cure right away. But within our tumor tissue, and particularly in brain cancer, it's the same with breast cancer, right? There's biomarkers, there's genomics, there's molecular structure, there's all these things within the tumor tissue that, if diagnosed like a comprehensive genomic testing is done on that tumor tissue, it will identify proteins and biomarkers that there are drugs that are FDA approved that will target those proteins or those biomarkers and therefore kill the cancer. But when we treat everybody the same through current standard of care, we're kind of missing the boat. We're not treating the disease as an individual disease when we're right now using current standard of care. I will say I've been in this space for truthfully about 24 years, and I have seen advancements in our standard of care for this particular disease. Thank goodness. We have a ways to go because science is so wonderful and fantastic, and we now know there's a lot more about this disease and how to treat it. But science moves slow, and FDA approval of certain drugs or devices or diagnostics to treat this disease is very, very slow and very expensive.
So a couple of questions come to my mind. You keep referring to standard of care, but then let's go back a little bit further before the standard of care actually takes place. What would be some of the signs that someone would even go and get diagnosed to think that they would be diagnosed for this?
That's a good question. A lot of times people will not know, and all of a sudden they have a seizure. So that brings them into their local community hospital, ER usually, and then they have a CAT scan or an MRI, and they're told they have what looks like a primary brain tumor. And current practice is also challenging right now, and that is one of the reasons that my late husband, and I created the In Brain Cancer Initiative, is because what usually happens is an incident happens and the patient is brought into an ER at their local community hospital, and they are diagnosed with what looks like a primary brain tumor. They're admitted to that hospital, and they have surgery usually within 72 hours.
Oh, that's quick.
That's really quick. So that means, you get this shocking news that you have what looks like a primary brain tumor. And here's the thing. Some people don't even know what a primary brain tumor is, which is fine.
That was going through my mind right now.
I'll explain that in a second. But then you literally have surgery scheduled, and you have very little time to research, like for specialists and for centers of excellence related to brain tumors. And at that point in time, you're not told you have brain cancer. You're told you have a brain tumor. So you're not thinking brain cancer. Well, at least I know that I wasn't. And when I talk to a lot of patients, they're certainly surprised when they learn that they have brain cancer as opposed to a brain tumor. So a primary brain tumor is a tumor that starts in the brain. So it doesn't develop like in your liver or your breast and travel to your brain. It develops within your brain initially. Okay. That's a primary brain tumor. So standard of care right now, and the practice of surgery usually within 72 hours, So you have your surgery if your tumor can be removed. And think about this. When you're diagnosed often at your community hospital, they may not have the best of the best equipment for surgery. They may not have the best surgeon skill set for the surgery. Therefore, they may say that the brain tumor is non-resectable or we cannot remove it. So one of the things that the In Brain Cancer Initiative does is we help people seek those second and third and fourth opinions on the neurosurgical side with specialists who are removing people's brain tumors, like 300 a year, that kind of
300 a count?
300 a year,
Oh.
So when you're removing that many brain tumors in a year, you're a specialist.
Where they're at.
It really matters where you have your surgery. It also matters where you are treated for your brain tumor or your brain cancer. But that's the amazing thing that people don't understand. And so that is also one of the things that the In Brain Cancer Initiative educates about. So
is education not just it's a program. Resources.
Yes.
And the care.
Yes.
And I wouldn't say counseling.
Well, I will say although we do not have a social worker on staff,
Okay.
we are able to refer patients to different social workers wherever they live in the United States.
Perfect.
We work very closely with social workers, although we don't have one on staff right now. So you mentioned programs. Yes. Our very largest program is our Patient Disease Education Awareness and Outreach Program. So we are creating disease education content pretty much every day. We turn some of that content into blog posts. We turn some of that content into printed articles. We turn some of that content into social media posts. And we turn a lot of that content into the verbal. We are talking to patients and their care partners every day. They find us, which thank goodness they find us. I will say that most people find us after surgery because of the practice of having surgery within usually 72 hours. And what we're doing is we're listening to them, and we're listening and learning what they know and what they don't know. And then we know how to help them and how to educate them. You know, we kind of hear the unmet need, right, and go for it and educate them in a gentle manner, because we want everyone to understand that they should be working with a specialist on the neurosurgery side and the neuro-oncology side. But we never want to make anyone feel bad if they're not.
So Jen, when she was in here, had a device on her head. Is this one of the things that you help assist in finding a way to identify whether that's going to happen again? Because she said this is a lifetime type of device that she has to have.
It is. For her, the device you're talking about is the Optune Geo device. And it is the first device to treat GBM, FDA approved first device ever. So that's incredibly exciting, number one.
Absolutely.
She will wear that device for her life. And that's the thing about advocacy. So we've been around for a really long time, right? So we've been very busy in the advocacy space, advocating for new treatment options. Advice. I was pleased enough to be asked to testify to the FDA before that device was approved by the FDA to help them understand what it's like to have brain cancer and to have very limited treatment options, and why this device was so important to patients, but also, frankly, to other companies and innovative companies that are going to come forward and maybe have another device to treat brain cancer, right? So that was really exciting when we did get that FDA approval back in 2011.
Okay. And you keep referring to FDA, and we all know what FDA is, and there must be quite the information you have to provide for them to say, yeah, this is something we are going to approve and back it up. When you talked about how you had to give information to say this is a device that's a must, what kind of information did you have to provide them to say yes? Because it's not an easy task from what I understand.
Oh, it's really hard, actually. And before I say that, I wanted to salute the companies that are coming forward and investing in glioblastoma research, because it is a long battle to get your drug, your product, your diagnostic
because it all costs money.
Approved. It costs
a lot of
so much money.
I know.
I wish it weren't true, but it really does. So clinical trials are how companies gather the data, so to speak, from patients actually using the device or the drug. And there's all kinds of FDA regulations that they must meet. And so they'll start with a phase 1 clinical trial. And that is usually related to dosage and safety, right? And if things look good, then they move on to a phase 2 clinical trial. And so they include more patients into the clinical trial so that they can gather more and more data, right? And if all that data looks promising to patients, then the company will go forward with a phase 3 clinical trial. and it usually involves a large group of patients. And so it takes quite a while, but eventually, if the data is promising, the data is prepared by a third-party company. The company has nothing to do with it. And that data then hopefully looks good. It'll be published. And then the process of going forward to the FDA for approval starts. And so advocacy organizations like the End Brain Cancer Initiative can be really, really positive for this process, because we can gather patients who would like to have access to the treatment or the drug or the device that one is seeking FDA approval for, and we can gather them and we can allow them to express their feelings directly to the FDA. And we can help educate the FDA about the need for new treatment options. One of the things that was interesting for me a long time ago when I started this whole process and started getting to work with the FDA in the advocacy space, truthfully, is the lack of information that members of the FDA have when we're talking about brain cancer, and fully understanding the need of the patient to have more tools in their tool belt, right, to fight this disease, because that's what it needs.
Well, we always hear about these different forms of cancer that are coming about, whether it's in a pet, a child, or whoever, all living. It's all experimental still. So they're thinking, how am I going to back something up if you don't have what's necessary to say, yeah, this is going to work? And I wanted to bring this back a minute. For anyone who's actually watching this or listening to this, give us more information as to what this device is. What is it actually doing that we've talked about? What does it have to be FDA approved for?
So the Optune Geo device, it's really TTF tumor fields. And you're like, okay, so what's that?
Right.
And really what it's doing is very simple. In biology, we learned this a long time ago, like when we were kids or in school. And it's really literally messing up the ability for the cancer cell to divide. And it's done with electricity.
Okay.
Yeah. So that's exactly what it's doing, that particular device.
Now, with that being said, you and I both know that Jen was diagnosed yet again with another brain tumor, and then she has this device, but that device actually was able to find it faster than her initial diagnosis with her first seizure, as you mentioned early on.
Yeah, and I don't know a lot about that, but I can tell you maybe what I suspect. With the Optune Geo device, you're monitored very, very closely. And so probably something within that monitored process identified her brand new brain tumor much faster than she would have if she were going to see her neuro-oncologist every 3 months or so. I also want to say that's one of the beautiful things about being in a clinical trial. You are, as a patient, you're monitored so much more than you are if you're just a regular patient, right? Under standard of care. And so one of the things we talk to patients and their care partners about is the fact that being in a clinical trial, if it makes scientific sense, is a really great move, because you're being proactive, and your physicians, your researchers who are watching you and taking all of the data that you're giving them, that your body is giving them, they're using that data to really think about how else to treat your brain cancer. But they're monitoring, meaning they're reading that data constantly. And you're seen more often when you're in a clinical trial as a patient by the physician or the researcher or the principal investigator. I think it's a really good idea. When you're thinking about a terminal disease and current standard of care is not creating a lot of survivors. It's about 6% will survive 5 years for this disease now. It used to be so much less. But when you think about that, then you should think about the fact that clinical trials really maybe are my only chance of quality of life and surviving this disease. And that's what you want. And you also, with this disease, you have to, I mentioned tools in your toolbox, right? You know, this disease is super smart. And those cancer cells can sort of change and manipulate themselves so that whatever treatment or drug you're on isn't as effective anymore as it used to be, right? So you always have to keep fighting this disease with something new or a combination of drug and device. That's how people are beating this disease.
And Jen's she's the only one I have to reference to, but she has done just that. I understand that you have a new program that you're launching or is already in effect through your organization.
Well, gosh, I feel like we have a lot of
I thought it was
programs.
a patient program, but I could be incorrect.
Well, we've got, like Jen, I met Jen, right, through a program that we have called our National Hope Award, and it's a disease education awareness and outreach program, and it's an annual program that we do every single year. And why we do this is because we want to shine a light on the patient that has brain cancer. But we also want to shine a light on those people in their lives. And so we allow, we're about to kick it off for 2024, and we allow people who have people in their lives who have brain cancer to nominate the person in their life and how they inspire them every day, how the person in their life with brain cancer is living their life and inspiring others. And so that's actually how I got to meet Jen.
It's interesting. People say you live to the fullest. Well,
Yeah.
depends on what the fullest means to you. And I have to say she's doing that and then some.
She is. She's
not letting the disease say, this is what's happening and I only have this amount of time to live. She's like, and she even said it here. She's like, I'm going to go as far as I can, as long as it's, whatever it's going to take is what she said.
Yeah, exactly. And she hikes and she's out there talking about this disease. I will say she's a great patient advocate.
She is.
She's done an awful lot for disease education related to GBM and glioblastoma. She's also her sense of humor is great. She's funny. I'm lucky enough to get to hang with her a little bit and get to have lunch with her later on today. So that's exciting. I can't wait to see her. But we also have May is National Brain Tumor Awareness Month. I'm not sure.
Okay.
And so we always kick off quite a few things, starting just about now for 2024 when we think about programs. And so we have something that has become a really awesome online global disease education program, and it's called Know All Your Treatment Options. So it's an online 4-hour program where patients or whoever, they can write in questions and send them to us ahead of time. And I produce it, so I create it, and so I invite different doctors and specialists to come in and talk about things we might not know related to brain tumors, brain cancer, different types of diseases. And then they present it, and then we create little snippet videos, disease educational videos, and then plaster those all over the place so people can keep learning. And so we're ready to kick that off as well. That will be on May 17th this year. And I just encourage everyone to go to our website, www.endbraincancer.org. You can register or you can ask questions. But it's just such a great event.
And this is virtual, even though I mentioned you're out of Washington State.
This is virtual, and it is a global disease education segment. Yeah, we're based in Washington, just outside of Seattle. And for 10 years, we were in my home. And about 10 years ago, we were able to actually be able to afford office space rent, and go from there. And we've actually just doubled our space recently, which is kind of cool.
That is good.
Yeah.
It's good and it's not good. It's like
I
we don't
know.
want the people to be there, but you have the place for the people. So it's both.
Yeah.
Congratulations on that.
Thank you.
How can we help you? You've already given your website.
I would say that we are a 501c3 nonprofit patient advocacy organization. So one of the ways we sponsor all of our programs and services, because those are all free to patients and their care partners, is we utilize sponsorship. So corporate sponsorships. So companies can sponsor a segment of our National Hope Award, or they can sponsor, or I'm looking for a presenting sponsor for our Know All Our Treatment Options for this year. We haven't quite secured that yet. The other thing is just honestly go check out our website. There's a lot of information on our website that, yes, it is brain tumor and brain cancer specific, but a lot of it applies to regular cancer disease. So what you learn about brain cancer can also usually be beneficial to any kind of cancer as well. So I would say that's the best way to help us.
I think we could possibly do that.
Thank you.
It has been a pleasure sitting down with you and learning more about your organization and how it's making a difference, not just by someone I have personally met in this organization in Arizona, even though you're in Washington, but to know that there are other people that you're touching that probably don't even know that you exist, which I love being able to be that resource. And I hope that whoever sees this reaches out to you.
I hope so.
Because that's one life that's being saved, right?
Absolutely. Absolutely. Yeah, we're really easy. Just go to our website. You can fill out a super short form. It allows us to reach back out to you. Or you can call our phone number that's on the website as well.
Wonderful. Thank you for being my guest today.
This inspiring story was brought to you by MMG, your global creative agency based right here in downtown Chandler.